Hi, the group of Devontae Fitzgerald, David Cimino, Lauren Huffman, and Meghan McNeill will be presenting on behavior addiction and family counseling. So what is behavior addiction? Behavior addiction is characterized by the presence of a non-substance related behavior that an individual impulsively and or compulsively acts out regardless of potential consequences. So you may notice that non-substance related is bolded and underlined in this presentation. And that's because while there are many parallels between behavior addiction and substance related addiction, the distinguishing characteristic of a behavior addiction is that it's not substance related. So typically when people think about addiction, their first thought tends to go to drugs and alcohol, nicotine, and things of that nature. But with behavior addiction, that's not the case at all. There is a problem behavior that is not substance related. And it's a behavior that an individual continues to act out and it causes issues elsewhere. So as with substance related addictions, people with behavior addictions often continue the problem behavior, even though they believe they should stop or have faced consequences related to it. So let's think about the substance related addictions. Let's think about someone who may be struggling with alcoholism or someone who may be struggling with an opioid addiction. An alcoholic may have received a DUI or several DUIs, and an opioid addict may have overdosed numerous times. And then in time, they may find themselves right back to using drugs and alcohol, even though they have faced significant consequences. Behavior addictions are pretty much the same way, that even though the behavior may cause them issues, the individual may have a hard time resisting the temptation and urge to act out the behavior. And these behaviors, when repeated, interfere with other domains of life, such as health, work, and family. So let's look at a few examples of behavior addictions. Gambling is viewed as the prototypical behavior addiction. It is widely recognized as a behavior that's not substance related that an individual can lose control of. And I think it's a great place to start the discussion because of the recognition it has. But it's not the only behavior that an individual may become addicted to and face lots of different troubles and struggles related to that behavior. So you may also think about shopping in the sense that someone may not be able to control their impulses to buy, and what type of issues that may cause in a marriage, the type of things that could cause in the family. Stealing is a compulsive behavior. It's known as kleptomania. This may be something that someone may just be in Walmart and they cannot resist the urge to take something and put it in their pocket or put it in their bag. Compulsive internet use. You know, we've entered the era of smartphones, and some people have a harder time detaching from it than others. There may be some people that if you were to take their phone away for 20 minutes, they may really go into a state of distress. Video gaming is also a thing that we see with adolescents and young adults and even older adults. And it may be something that, again, can cause a lot of issues. Hypersexuality, acting out sexual behaviors, watching pornography. All of these things can be behaviors that create significant issues for an individual and their families if continued to act out. Binge eating, exercising, and tanning. And when you think about exercising in particular, it seems like a pretty positive behavior on the surface, but when when acted on excessively and impulsively and compulsively, it can really cause distress to the family, and can really interfere in those other areas of other domains of life, such as work, health, and family and other social interactions. So this is a list of behaviors that individuals they can become addicted to if they are not effectively regulating their use. A few more things to note with behavior addiction, like substance addictions, behavior addictions typically have an onset during adolescence and early adulthood, which means the pattern can start at a young age, and through repeated use or repeatedly acting out the behavior can start to reinforce the addictive cycle. There is usually an urge or craving that precedes the problem behavior. So maybe it's stress that causes people to return to the casino for one more game. And or maybe it's just that they have not been to the casino. Maybe they haven't played a video game in 12 hours, and there's now an urge for them to return to that behavior. Evidence has shown through research, evidence through research has shown that serotonin and dopamine are key factors in the development and maintenance of behavior addictions. So just like we've learned with substance-related addiction, the brain chemistry can be significantly impacted through repeated use or repeatedly acting out these behaviors. Serotonin is involved in the inhibition of behavior, and dopamine is involved in learning, motivation, and rewards like systems in the brain. Tension or arousal tends to come before acting out the behavior, and then after acting out the behavior, there tends to be a sense of pleasure or relief.
Using cognitive behavioral therapy to treat behavior addictions. Cognitive behavioral therapy, or CBT, is a widely applied, evidence-based therapeutic technique whose effectiveness has been studied with respect to several behavioral addictions. This quote summarizes an aspect of the treatment's philosophy and encapsulates its potential benefit. Within CBT, any given behavior is seen as a function of the specific environmental and internal conditions surrounding it. CBTs are therefore designed to target specific symptoms that are identified as part of the diagnosis or presenting problem for treatment. This perspective makes CBT essentially perfect for behavior addictions, which are characterized by compulsive or out of control engagement with a behavior that has become damaging. CBT allows the therapist to create an approach that is totally nuanced to the presenting symptoms. The therapist then empowers the client to see their environmental and internal conditions according to a new framework. The client learns to see the relationship between situation, automatic thoughts, and reaction, and how that process triggers an emotion, behavior, or physiological response. In the case of behavior addiction, the client will certainly focus on the behavior in question, exploring the framework that leads up to the compulsive engagement with that behavior. But they also need to consider the emotion and physiological response that accompanies the behavior, because it's highly unlikely that that will occur independent of any emotion or physiological response. Bouchard et al. Have compiled data from several studies that indicates efficacy of CBT applied in tandem with virtual reality when treating gambling addiction. In the VR environment, comparable urges to gamble are elicited. These urges are not shown to be any more intense or unmanageable than those elicited in real-world settings. As a result, the VR environment is thus an inherently safer way for CBT, or inherently safer place for CBT to occur, because the individual is able to go through the process of being in the situation, experiencing the automatic thoughts that occur, the reaction that comes out as a result of that, and the behavior, emotion, and physiological response that all come together. A meta-analysis of data conducted by Gosler et al. In 2020 suggested that CBT was an effective treatment for sex addiction, internet addiction, and compulsive buying. The studies considered under this meta-analysis demonstrated that among those conditions that have not yet been officially recognized in the DSM-5 as behavioral addictions, the currently available evidence regarding neurobiological indicators for parallels between substance-related and non-substance-related behaviors mainly comes from the areas of internet addiction, sex addiction, and compulsive buying.
Hi, so this is the part of the presentation where we're going to discuss addressing behavioral addictions with a family. My name is Meghan McNeill. Let's just jump right into it. So the very first thing that you're going to want to do when working with a family that is presenting or maybe presenting with a behavioral addiction is to make sure that all the people in the family that are presenting have an understanding that a behavioral addiction is real and that the behaviors that maybe the family are describing are rooted in an actual addiction. So an example of this would be like for maybe a family goes into counseling and they are upset with their oldest son's internet usage and they see it as a lack of willpower or a lack of his ability to self-regulate or whatever that may be. But then upon further investigation, you realize that it's actually an addiction issue. There may be some hesitation from the family to really buy into the fact with their own understanding in validating that this is an addiction issue. And this is actually coming out because, I would say this is actually could be stemming from the fact that prior to 2013, non-substance related behavioral addiction was not indicated. There was no classification for behavioral addiction in the DSM-4. So the DSM-5 came out in 2013. So, I mean, does this mean that we didn't have any behavioral addictions before 2013? Oh, we did. We just didn't have a clear classification on diagnosing them. So, therefore, because 2013, the grand scheme of things is not that long ago, it may be difficult to get a family to see or understand that a behavioral addiction is an addiction. And this may delay treatment or the efficacy of treatment. Because if they're not ready to really understand the behaviors as an addiction and they're shaming and blaming the addicted and just becoming very frustrated with the addicted and not getting the family or the addicted the help that they might really need, it's going to delay treatment, it's going to delay recovery. Okay, so typical approaches for addressing behavioral addiction with the family. So this is like the stuff that you do in the very early stages. Number one, you're going to want to get the whole family on board and understanding that behavior addiction is an addiction, and that there are bioneurological pathways to addiction with some of these behaviors that we're talking about here. And it needs to be understood as an addiction and treated as an addiction. Number two, you're going to want to work with the family for reducing blaming, and you're also going to want to work with the family for reducing shaming. And these three objectives here, reducing blaming and reducing stigma, and also getting the family to understand that a behavioral addiction is an addiction. These three objectives can be met by working with the family around with a psychoeducational approach. So teach the family about the nature of addiction, about the nature of their behavioral addiction, and using this to tailor a psychoeducational approach to the family. So if it's just an example, like let's say it's an internet addiction, or maybe working with the family to understand how the various forms of the internet could be filling the void for love and connection for the addicted. Or maybe they're finding it as a way of stimulating their brains because they have low levels of dopamine. There's, many different hypothetical situations that we can discuss here around behavioral addiction and tailoring psychoeducation to a family to better understand their loved one. You're also going to want to be teaching skills for coping, and you're also going to want to be working with the family so that people in the family could be taking responsibility for the various roles that they play. So is the enabler, if it's a gambling addiction, is there someone in the family that is constantly bailing the person out, so that they can kind of see their own role in the family and how it interacts and interplays with the addiction and the addicted. So also as a therapist or as a person working with the family, you're going to want to identify key family features and key family values. You're going to want to learn the communication patterns of the family. And you're also going to want to identify any family dysfunctions. And to do these objectives, so identify key family features, learn communication patterns of the family, identify family dysfunctions. To do that, you're really just going to want to be observing the family, observing who connects with who in the family. And then above all, you're going to want to be encouraged. You're going to want to encourage hope. Now, this information about approaching the approaches for addressing behavioral addiction with the family was heavily supported with our Module 2 lecture. Because although that the Module 2 lecture really gave these pointers or this information out as a more general view, you would be using these types of strategies in the early stages for approaching a behavioral addiction with the family, and also in the process of joining the family with a behavioral addiction, because a behavioral addiction is an addiction. And so you would be using these identified best practices for addressing the issue, getting the family to work together, getting the family to understand the level of need or the fact that need is even needed, would be more. They could be used in this situation as well.
So we're going to talk about some cognitive behavioral therapy techniques. What CBT is a great approach because it is all about changing maladaptive behavior, and there's so many different techniques, but we're going to just quickly role play two different techniques, with the first technique being cognitive restructuring, which cognitive restructuring is all about taking the way a client thinks about their addiction and sort of making them do a cost analysis, maybe a pros and cons, with them ultimately realizing that the pros of an addiction certainly do not outweigh the cons of an addiction, and hopefully that helps them get to a better place on the change they need to make.
So Brianna, we've been talking a while about your addiction to your device and how much you use the internet on a daily basis. I want to try something real quick and ask you just a few questions. First, I just want to ask, in your mind, what are you getting out of being on your phone sometimes 8 to 10 hours a day?
Well, when I'm doing it, it's entertaining. It's form of entertainment to me. It's fun in the moment, and I enjoy being online.
And then, well, what do you think the long-term effects of that are?
Well, I do have a hard time sleeping. I guess it's because I'm actually not really doing that much. Yeah.
Now, when you said the long terms, can you think of any pros that you might get out of being on your phone that in those lengths?
No.
And how does that make you feel?
Kind of gross. Kind of like I'm probably just wasting my time.
And is that something you want to change?
In retrospect, yeah. Yeah.
Okay.
So that was cognitive restructuring. Just one example of the many ways that could be used. The next thing we're going to demonstrate is a role play on goal setting. In this role play in particular, we're going to talk about SMART goals, which are, they're specific, observable kind of metrics that the client and counselor can use to chart the client's progress. It helps the counselor, work on long-term treatment. It helps the client maybe give themselves a little credit for making some progress because they can see it in real time. You can track it day to day. So we're going to briefly touch on that in this next role play, and thank you for watching.
So, Brianna, you had mentioned, in our last section that you were thinking you were ready for a change.
Yeah.
I thought we were in this point where we might want to talk about alternatives to, work on some more healthier behaviors.
Okay.
So right now, would you say you're still using your phone about 8 to 10 hours a day?
Unfortunately, yeah.
Okay. So we just want to, slowly decrease that until we can get you to a healthy space. So yeah, I think you should maybe discuss alternatives. Do you have something in mind that you think your energy would be better put into?
Well, I really like doing crafts. I have a lot of hobbies.
Okay.
Yeah.
Now, is craft something you think you could swap for your phone? Do you think you could leave your device in the other room and focus on crafts?
Could I play music?
I think that's a reasonable compromise.
Okay. Well, yeah. I mean, once I get into a craft, I kind of just get lost into it, but at least I'm active.
Okay. Well, so that being said, why don't we try to turn that idea into a goal for you? We're going to use something called SMART goals. They are measurable, specific, and time-sensitive goals that will help you kind of chart and manage your progress.
Now, is this something that is going to be a lot to take on? I'm kind of nervous about drastically changing this habit.
Not necessarily. It's something that we can tweak if it does seem to be a lot. But and we're making the goal ourselves. So I mean, you're telling me, you're giving me your input, and then we're gonna.
So I'm kind of in charge of it.
Absolutely, this is your journey. It's your goal. I'll just kind of maybe steer you into the right phrasing or framing of it.
Yeah.
But so you said crafts is something you think would be a good kind of thing to do rather than being on your phone?
Yeah, I think that would be a good alternative.
Okay, so why don't we try for you to work on a craft project for maybe 2 hours a night instead of being on your phone?
Yeah, I mean, I could probably do it for longer than that too. So
okay,
yeah.
Well, why don't you can, like I said, we can increase or decrease as we go, but let's try for 2. We don't want to,
take on too much.
Yeah.
Yeah.
So let's say, we'll try to do crafts for 2 hours a night with our phone in the other room.
Okay.
And do you think that's something you could do 5 days a week or 7?
Yeah, no, I think I could maybe start out with 5
Okay.
and then maybe next week try 7.
Okay. So why don't we make your goal, Brianna will do crafts 2 hours a night with her phone in the other room for 5 days, and then discuss the results to increase or decrease the goal.
Hopefully increase.
Okay.
Yeah.
Well, great. So does that sound good to you? Is that something you're comfortable with, all this?
That is something I'm comfortable with, yes.
Okay, great. Well, I'm glad that sounds good to you. And like I said, we can discuss this in our next session, and we'll kind of look at how you did, and I want you to tell me how you felt about it, and we can go from there.
Awesome. I look forward to it.
All right, thank you.
Thank you.
Thank you.
So that was just a few techniques. We had cognitive restructuring and goal setting. And yes, those are two of many. CBT is a very versatile form of treatment. There's, God, it's a key that opens a million different locks. It's one of my personal favorites because, you know, behavior, changing behavior is challenging. It's a great tool to begin that process. But this concludes our presentation on behavior addictions. I hope you enjoyed it, and thank you so much for watching it, and have a wonderful day.